Hello dear friends and colleagues. Today I'm going to show you consequences of severe calcaneal fracture Sanders 4. This young 35 years old patient had got in a severe vehicle accident in a rally race car at a speed of about 120 km per hour. As a result, he had got multiple skeletal injuries, including calcaneal fracture. I'm not going to discuss all the injuries he had got, but almost all major skeletal segments were involved. Take a look at the CT scan. There is severe comminution of the posterior articular facet, lateral displacement of the calcaneal tuber, and severe comminution of the anterior part. There were limitations in application of Sanders classification because there were no slices with more than 3 articular parts. But definitely there were 4 parts or more. The surgery of the foot was delayed because of large number of surgical procedures due to multiple skeletal trauma. Finally, osteosynthesis of the calcaneus was carried out at 5th week after trauma. The purposes of the surgery were to make an adequate suspension of the talus and to restore calcaneal tuber position. Reduction was performed in an open manner through the extended lateral approach. Sadly, I don't have photos and video of the surgery. Take a look at postoperative CT scans and X-ray views. Reduction of the facet is not perfect, but the facet is near anatomical, and orientation of the calcaneal tuber is restored. Severe displacement remained in the anterior part, because any manipulation in this region turned the bone into a mass. Due to comminution, stable fixation became a challenge, even with use of modern locking angular stable plate. So transarticular wire fixation was needed. The wound healed without complications. The wires were removed at 2 months after surgery. The patient completed several rehabilitation courses and underwent several surgical procedures because of non-unions in other segments. Thus, it was impossible to estimate the functional status of his foot for a long time, and the patient had no complaints about it. 4 years after the surgery, when all other problems were resolved, the patient came to us to estimate the function of the foot. Now he had several complaints about limitations in foot joints movement. CT scans revealed spontaneous ankylosis of the subtalar and calcaneocuboid joints. Despite this, the patient demonstrated good function for such skeletal situation and absence of pain. He returned into sports as a race driver and had got his first victory after trauma this year.